Whitman being the one that was behind Kid Care.
And she was a Republican.
Okay. None of this, again, age-blind, disabled, long-term care, whole different program. So that's part of Medicaid, but it's a bunch of different rules, and it's very strict on knowing what you did with your money in the bank. So the Affordable Care Act comes around in, let's see, 2010, I feel like it's. And I always like the H&R Block commercial that said, oh, we read the 900 pages of the Affordable Care Act, we know all about it. Yeah, well, I had to read 1,600 pages, so I don't know what they were talking about. The Affordable Care Act was, yeah, it was thick, and there was a bunch of different sections. There was the IRS section, there was the Medicaid section, you know, so we sat around the table, we read it, it was proposed first rules. We had to go through the proposal, we had to then write up a comments to say what we thought would work, what didn't work, and then we sent it back to the federal government. I don't think they took any of our changes, but finally in, I guess 2013, the summer of 2012, we got the official regulations. So it was signed into law March 2010. The law required all individuals in the United States to have health coverage beginning 2014. ACA created an exchange or marketplace for individuals to purchase coverage. We do not have a state marketplace. We do use the federal marketplace. But you can go online and everything should be the same application that we're using at the county welfare agencies, give or take maybe a little bit of tweaking, and what the federal government is doing is all the same. And you can go online and apply, and they will say, yes, you're eligible for Medicaid, or you're eligible for a tax credit. Health plans must meet a minimum essential coverage requirement, and they include 10 essential health benefits. And the law also requires states to expand their Medicaid programs in 2014 for individuals, all individuals, up to 133% of the federal poverty level who are not eligible for Medicare. I've been working for the state for kind of a long time. My mother never knew if I worked for, she always told everybody I worked for Medicare. Medicare is through Social Security. I worked for Medicaid, again, an entitlement program through the state of New Jersey, both the federal and state program. In 2014, okay, we can cover everyone up to 133%, not eligible for Medicare, because once you're eligible for Medicare, all bets are off to go back to the old program for the age-blind and disabled. A Supreme Court decision in June 2012 changed the expansion requirement to a state option. And yes, New Jersey did take the state option to expand Medicaid for all individuals up to 133% of the federal poverty level. It also changed how we calculate eligibility for both Medicaid and CHIP. Our way of calculating eligibility was really very, very difficult. And for the age-blind and disabled, it all stays the same. But for the Affordable Care Act, it looks at an income, it looks at adjusted gross income that we'll talk about in a minute. The expansion, we covered foster kids, former foster kids, foster children up to the age of 21. Like if you're on foster care, you usually lose it at the age of 18. We covered it automatically to 21. Affordable Care Act says you get it until you're 26.
I just want to stop you, but does everyone know what foster care is?
DIFUS. Oh, they're not called DIFUS anymore.
Foster care is when children are not living with their parents that have been either removed or are not there for another reason and are placed either in a family that is hosting them or in some kind of institutional situation. It's not a happy situation.
No, and that was a good thing. That was a good thing. It was good that at least we covered them up to 21, and better yet that we cover them up to 26. Expansion of childless adults and parents, caretakers up to 133% of the federal poverty level as state option. New Jersey took it. Plus there was new doors for eligibility for individuals to apply. You could apply for the federal marketplace, or you could apply by telephone. You could go to one of the welfare boards and apply there. You could apply mail-in through New Jersey Family Care. But you must have all heard a little bit, that marketplace didn't exactly get up and running immediately. There was a lot of problems.
Okay, we have a question?
Oh, sorry.
Go back to the foster children situation.
Mhm.
What if like the parents, the biological parents are removed, but the children are living currently with their biological grandparents? Would that also, they also be able to get those benefits as well, or?
Biological grandparents, usually if DIFUS is, well, it's called PCPA.
Children Protective Service.
Thank you. If they're involved, that's usually when you got Medicaid for that child. And even if the grandparent, well, if DIFUS wasn't involved, those kids were usually on New Jersey Family Care because a grandparent isn't responsible for their child, for a grandchild. So with the children having zero income, they would usually be eligible for Medicaid and they would get their medical insurance that way. But it's usually the foster care is when Child Protective Services is involved.
So then the biological grandparents, they're taking care of their actual grandchildren, they would not be able to get funding to help pay for the reasons.
I guess only if they went through foster care, through Child Protective Services, which some do, and I think some don't. But if